Hello, my name's Jason. I volunteer as a healthcare manager for Crisis at Christmas. In my day job, I'm a registered nurse who works for a charity.
Hi, I'm Jo. I volunteer as a deputy healthcare manager for Crisis at Christmas, and in my day job I'm a drug and alcohol nurse.
In this short video, we'll just be explaining what to expect when you come on shift, and this is whether you're a first-time volunteer for the healthcare service or you've volunteered for many years. The first thing we'll do is sign in. This is to make sure we've got a record of who's turned up for shift, and so we can allocate people to various roles and the clinics that will be running that day. We start each shift off with a briefing. This is so we can give an overview of how we work, some of our policies and procedures, and make sure what we do is the best care possible for our patients. Within the briefing, we also do our allocation. This is a bit which can take some time. The first part of the briefing we try and get done in 15 to 20 minutes. The allocation can take around 15 minutes, and this is where we allocate our doctors, nurses, pharmacists and receptionists and team leaders to the clinics we're going to go to each day. Each centre we visit every other day, so we run 5 clinics a day. People sometimes get a bit worried, and what kit and equipment do they need to bring along for running a clinic and on shift. At Crisis, we provide all the kit you need, whether that's what we call our hard kit of stethoscopes, blood pressure machines, blood glucose machines, through to the soft kits, which is dressings, bandages, dressing packs, all things like that. If you do bring any of your own kit with you, such as a stethoscope, that's absolutely fine, but please make sure you look after it during the shift and you do not use it. We also supply all the medicines that we need, and from the other videos our pharmacists have talked about how our pharmacy services works and how we safely manage medicines. Our next one is around the teams, and when you go to a centre, before that, as I've just mentioned in the allocation, we divide you into teams. These are all based on experience, so you'll have an experienced team leader with you, and also we'll have doctors, nurses, pharmacists. Some may have volunteered for Crisis and be very experienced. Some people it may be the first year. The key thing is we make sure that we work as a team, and communication is really important. We also do a safety huddle and introductions. So when you're allocated into your teams, your team leader will introduce themselves, and it gives the opportunity for you to introduce yourself to everybody, say a little bit about what you do, what your clinical skills and knowledge are, and also we do a safety huddle as well.
The safety huddle is basically where we just go around and say anything any particular areas of strengths or interests, stuff that we want to do, any areas where we might need a bit of support, and we just make sure that we've got people to we know everyone's skills and we know who needs support with what, and it's really useful. There's often a lot of surprises, and yeah, it just means everyone can work as a team better.
Yeah, and within that, it's also if these teams have been to a centre previously and run clinics, we take all the medical notes with us so we can highlight any patients who we've got concerns around and make sure we can follow those up, or if they've got any medicines or if they need to review, that we can take the appropriate actions. So the big thing around this is, working together and making sure what we do is in the best interest of our patients. Travel, when you go to any of the centres, Crisis provides a travel, so we all start off at the main healthcare base, have the briefing, collect our kit, then we all travel off together to the various centres. If you have got your own transport with you, anything we do have, if you can leave it parked near the centre where the healthcare base is. Some of the centres do not have any car parking around them at all, or any accessible parking, so we need to make sure that people get to the centres they need to be on time to run the clinics. In relation to travel on the way back, you can either travel back from that centre or come back to the healthcare base and travel back home from there. When you get to the centre, one of the things is around setting up. This will be directed and discussed with your team leader to make sure that actually we're using the space that promotes privacy and dignity, and is it a good environment for patients and our guests to actually access those areas. Some of the centres can be very, very busy, and the spaces we have can feel very busy. Again, it's adjusting to different traditional clinical working environments and being very flexible in our approach. All our clinics run throughout the day, and patients turn up, they will be initially registered by a receptionist, and then they'll be seen by a nurse, pharmacist or doctor. They don't have to be automatically seen by a doctor. If you feel that you've got the skill set to initially do the first assessment and then discuss it with a pharmacist or with the doctor or a nurse, that is absolutely fine. The key thing is we build our service so it's very flexible and very open for the guests. There's no 7 minutes in time to get a guest seen. If it takes 7 minutes to see a guest, that's fine. If it takes 70 minutes, that's absolutely fine within that. At the end of each clinic, we do a team handover. That handover is just to discuss any patients, any concerns we've got, make sure we've got good communication there, and also for us to say how the clinic's gone. And we do welcome recommendations for how we can improve the service in the future. The final bit is packing up. When we pack up, the key thing is making sure we've got all our kit, all the dressings, the blood pressure machines, stethoscopes, and also all the medicines as well. This is so that we close down properly, we leave the area nice and clean, ready for when we go back for the next time. And when we go back to the centre, the main healthcare base, we also restock all our kit and equipment up there. Finally is leaving the centre, and I touched on this a few moments ago. You can discuss with your team leader. If it's easier to travel home from that centre, you can leave from there and actually get the tubes or the bus. Or if you wish to come back to the main centre on the crisis transport and travel home from there, that is absolutely fine. Just please make sure your team leader knows if you're leaving from the centre or going back to the main healthcare base, so we know where everybody is. Thank you.